Good afternoon. My name is Ivy. I'm here to perform the intravenous medication administrations. Before I will show first my school ID. This is my school ID, and then my student ID number is 382292 382292. Okay, now I will show you my surroundings 360 degrees. So this is my right side. There's a television, electric fan at the back. There's aquarium, boxes. The what you call this? Other side is my left side is the windows. There's a lights, chairs. So this is my back of my back. Okay. Next, I will show you my documents in front of me. So this is my scenario, and then this is the back. This is the doctor's order, and there's the back of the doctor's order. Now is the mark, the back of the mark, the monograph, and then this is the monograph, and the compatibility chart, and then the back of the compatibility charts. Now, before I proceed, I will wash my hands to prevent contaminations. Okay, now I will read my scenario now. So Chinook Alizon, date of birth is 1960 December 11, ID number is 61497-342. Alison Chinook is a patient who has been admitted with right invasive ductal carcinoma requiring chemotherapy and symptom management. The time is 10 o'clock, 10:00, and Alison is due to receive her scheduled medication for pain management. Now I will verify the doctor's order with the mark. So this one, okay. Chinook Alison, date hospital number is 61497-3042. Date of birth is 1960 December 11. Then gender is female. Attending MD is Nadu Sarah. And then the health issues is admitting diagnosis is right breast invasive ductal carcinoma. Visit recent chemotherapy, symptom management, allergies, no known for allergy. Then the goal of care designations for Chinook Alizon is R1. Now for the medications is ketorolac, here, then 30 milligram IBPB every 12 hours. Okay, so now I will verify now the monograph. Okay, so the monograph is routes or acceptable routes is direct IV is yes, intermittent infusion is yes, continuous infusion is yes. It is indicated parenteral ketorolac is indicated for moderate to severe pain in patients unable to take oral non-steroidal anti-inflammatory agents. The dosage is 10 to 30 milligram intravenous. Then for intermittent intravenous injections, dilute the dose in 50 ml of sodium chloride 0.9% or dextrose 5% water. Administer over 20 to 30 minutes. Diluted solutions is stable at least 24 hours at room temperature or in the fridge. Now, the potential hazard with parenteral administrations for the CNS is drowsiness, dizziness, and headache. So, nursing implications, I will monitor the patients for allergic reactions or excessive sedations, patients INR PTT for prolongations of bleeding time, CBC for a significant decrease of hemoglobin, liver function test for elevations of patient with normal or abnormal baseline liver functions, urine output, and other renal function parameters for impairment of both patients with normal renal functions and patients with moderate renal impairment. Now the next is I will verify the compatibility chart. So this is the compatibility chart. So ketorolac is compatible with 0.9 sodium chloride. Ketorolac 0.9 chlorides are compatible. So now, now I will do now my verifications for allergy. So Chinook Allison, she is no known for allergy. So now I will do now my 3 checks for the medication, so mini bag solutions with the monograph. So here, first is the expirations. Verify the expiration date is June 2021. Now the solutions is 0.9 sodium chloride, and then sodium chloride 0.9%, and then the volume is 50 ml. Here is also 50 ml, and then the route is IBPB. And that's my first check. The second check is the expiration date June 2021. Then the solutions is 0.9 sodium chloride injection, and then here is sodium chloride 0.9%, and then the ml or the volume is 50 ml, and then here is 50 ml. Dilute the dose of 50 ml to sodium chloride 0.9%. Administer over 20 to 30 minutes. Diluted solution is stable at least 24 hours at room temperature of the or in the fridge. Third check is the expiration date is June 2021 here. And then the solution is 0.9 sodium chloride injection, and here is sodium chloride 0.9%, and then the volume is 50 ml. Here also in the monograph is 50 ml. Dilute the dose in 50 ml 50 ml to sodium chloride 0.9%. Administer over 20 to 30 minutes. Diluted solution is stable at least 24 hours at room temperature or in the fridge. So the route is IBPB. Okay, so that's my 3 checks for the mini bag solution with the monograph. Now I will perform now my first medication check with the MAR and the vial. So okay, so here, so right patient is Chinook Allison. Right drug is ketorolac. Then right dose is 30 milligram per ml, 30 milligram. Right route is IBPB, and then right frequency is every 12 hours, and right time is 10 o'clock. And then the right date to this date is June 4, 2021, and the right reason is to administer for pain medications. So that's my first check. Now next is I will open now my vial. So first, assuming this is not yet open, so this is open already because I practiced earlier. So I will open now the vial, then I will clean up with the alcohol swab in a circular motion in the 30 seconds and allow air dry. Okay, 1, 2, 3, 28, 29, 30, and allow air dry. Now I will open. Now I will calculate first the dosage and withdraw the right medication dose. Okay, for the dosage is the doctor's order is 30 milligram. So the doctor's order is 30 milligram of ketorolac, and then the drug on hand is 30 milligram per ml. So 30 divided by 30 milligram divided by 30 milligram times 1 ml is equals to 1 ml. So I will withdraw 1 ml of ketorolac. Okay. So now I will grab now my 3 ml of syringe. Assuming it's not yet open, I will open this in like a banana peel. Okay, this one. Okay, move the plunger up and down to loosen the syringe. Okay. Okay. Now attach the syringe to the blunt needle. Then make it sure to maintain the sterility. Okay. Now I will introduce air to 1 ml of the syringe. Okay. Okay, that's it. 1 ml. Okay, then I will inject this one, or I will introduce this one to the vial, the air, and then inject. Okay, inject the air to the vial and withdraw the medications into the 30 ml. No, 1 ml, I mean, sorry. Okay, so now make sure that the syringe, there is no bubble. If there's a bubble, tap on it with your finger and then prime the needle. Okay, here. So this is 1 ml here. Now I will cover this one, put it back to the cover with the needle. Okay. Now I will do my medication, second medication check with the syringe with meds, then the vial, and with together with the MAR. Okay. Okay. Right patient is Chinook Alizon. Right drug is ketorolac. Then right dose is 30 milligram per ml. And then here is 30 milligram per ml. And then for the syringe is 1 ml. Then the right time is 10 o'clock. The right date is June 4, 2021. The right frequency is every 12 hours. And the right reason is for pain medication. So that's my second check of medications. Okay, so now what's the next is I will inject now my medications to the mini bag solution. So first of all, I will wipe the white port of the mini bag solutions with the alcohol swab. As usual, 30 seconds in a circular motions and allow air dry. So this one, the white port. Okay, so okay, 1, 2, 3, 28, 29, 30, and allow air dry. So this one, inject this one your medications to the mini bag solution, then inject. Okay. Okay, maintain the sterility. All right, then inject. Okay, discard your your needles to the sharp container. All right, now grab the mini bag solutions and mix the medication to the mini bag solutions by turning up and down like this. Do not shake in order not to produce bubbles, because it can create bubbles. All right, now after this I will do now my third check medications. Before that, my third check medications, I will put on my label. Okay, where's my okay. All right, so the patient's name is Chinook Alizon. Okay, then the drug is ketorolac, 1 ml, and then 1 ml PB, then every 12 hours. Then June 4, 2021 at 10:00. Okay, so I will put my initials ILCPNL. So here one. Here. Ketorolac 1 ml IBPB every 12 hours, June 4, 2021 at 10:00. Patient's name is Chinook Alizon. Then I sign ILC or IB Luzon das Cabrelius, PNL, a practical nurse learner. All right, then I will attach this one to the mini bag solutions. Okay, so I will attach this one at the back of the mini bag solution where there is no written at all. Okay, so there's a written here, so this one is no written, so I will attach it here. Okay, this one. All right, so that's it. Okay, now I will perform now my um, my third check medications with the mini bag solutions, with the medication already, and with the MAR. Okay, patient's name, Chinook Allison, Chinook Allison. Then the drug is ketorolac, then 1 ml, then 30 milligram, then IBPB every 12 hours, June 4, the date today, 2021, and then the time is 10 o'clock and 10 o'clock. So I am signed up already. So this is my third check medications. Now I am ready to go to my patient's rooms to give the medications. All right. So the stuff that I need to bring only. So this one, I'm not using this one anymore. So I will bring the MAR, the compatibility chart, the medications, a mini bag solution with medications, the label, what else? The IV solution set. So the vials, not I will not bring that one anymore. And then I have here the alcohol swab, the hand sanitizer with the this. Okay, that's one. All right. Now I will go now to my patient's room. Okay. Knock knock. Hi Miss. Hi Mom. Allison. How are you today? She said she's good. By the way, Mom, my name is Ivy. I'm here to, I am your practical nurse learner today. I am here to give your pain medication. Is that okay with you? She said yes. Now I will verify the patients through asking her name and also verifying the ID band of the patient. So, Ma'am, can you tell me your complete name, please? She said Chinook Allison, and then your date of birth, she said 1960, December 11. So now I will verify the doctor's order. No, not the doctor's order. The ID band with the patients together with the MAR. Okay, so Chinook Allison, ID number 61497-3042, 61497-3042. Date of birth is the 1960 December 11, 1960 December 11. So that's my verifications of the patients. Correct patients. Now I will verify the primary line with the MAR, and then also the compatibility chart. So the primary line is sodium chloride 0.9%. Here is that in the MAR is the sodium chloride normal saline or sodium 0.9 sodium chloride. So here 0.9 sodium chloride, they are compatible. So now after this, I will perform my thorough assessment of my primary line from the hands or from the insertion site going to the pool. Now first, I will check if there's redness, and there's no redness, there's no swelling noted, there is no leakage of the in the insertion site. So now I will check the kink and also the bubbles, if there's bubbles, so that we could not introduce air embolism to the patient. So from here, I'm gonna check here. There's no kink, and bubbles. Okay, there's no bubbles and kink. There's no bubbles and kink here. There's no bubbles, there's no bubbles and kink. So sounds good. There's no bubbles and kink. Okay, so the date insertions of the insertion site, it was inserted today, this morning, June 4, 2021 at 800. All right, so now I'm done with my insertion. So now what I'm gonna next to do is I'm gonna clean up the white port of the primary line. Okay, using the alcohol swab. Okay. So this is the white port in a circular motion, 30 seconds, and allow air dry. All right. Okay, allow air dry. Now I will grab my secondary solution set. Assuming it's not yet open. So as I've said, I used this one already during my practice. So I will open this one. And then there's a hanger, blue color, so I will put this one here because I'm gonna use this one later on. I hope it would be okay. Sounds good. All right, I will put it back here. Okay. All right, now I will back prime my secondary line. Before that, I will close the clamp of the secondary line. So this one is it means is open. So if it is up, it means open. So I will down so that it will be closed. Okay. So the clamp is closed already. Okay. Now I will connect the secondary line set to the primary line. So I will open this one, remove the cap, and I will connect this one here. Okay, maintain sterility. Okay, now I will now open this the clamp slowly so that the solutions for the primary line, it will go to the chamber of the secondary line. Okay. Okay, as you've noticed, the solution is going up to the solutions. It's here. Okay. Okay. Now it's 1/2 of the chamber. Okay. Now I will check the solutions if there is bubbles. If there is bubbles, I don't think so. There is a bubbles. If there is bubbles, you have to check. You have to just stretch the tube. Okay, sounds good. It go up already. All right. So there's no bubbles already. So now what I'm gonna do, I will spike now the chamber to the medications, to the mini bag solution with the medications, I mean. All right. Okay. Okay. So what I'm gonna do, okay, I will remove the cap, the blue cap. Okay. Okay. Then remove the cap and spike. I will show it to the camera. Then maintain the sterility. Push, just push properly. Push until it push. Okay. So this is it. Okay. Okay, so it pushed already. I just want to make sure I did it push it. I spiked it properly. Now I will hang this one, the bag, the mini bag solutions. It should be higher to the primary solutions in order to work the gravity. Okay, so this one I'm gonna hang this one here. All right. And then I will down the primary line. Okay. Here. Okay. Now I will open this one. Open now the clamp in order to flow for dripping. Okay, so as you can see, it's drip already. So, okay, that's the solution. It means that there's a dripping. It means the medication is infusing to the patient. So, assuming there is an infusion pump, you have to connect this one to the infusion pump, and then you have to calculate the right the drips. So 50 ml this one, 50 ml this one, divided by 30 minutes, because you have to run it in 30 minutes, then times the 10 drop factor. So 50 divided by 30, then times 10 drop factor equals to 16.6 or 17 drops per minute. So you have to program it to the infusion pump if there is an infusion pump, assuming there's an infusion pump here. So I just verbalized. Alright, now before I forget, so I will put my label of my secondary line. Where is my pen? Here. Okay, so the date is 06/04/2021. The time is 10:00. My initial ILC or IB Luzon Luz-Cab. Say the line is secondary line. Now the solution is 0.9 sodium chloride plus ketorolac 1 ml. Alright, so now I will attach this one to the primary line. So now while I'm putting this one, attaching this one, I will give health teachings to the patients. Ma'am, if your hands is getting swelling or you feel pain, you have to report. And then second, if your dextrose is not dripping, you have to report as well. And then if you feel something like redness, if you experience itchiness, then shortness of breathing, you have to report so that we could address the problem. Now after that, we have to give comfortable, you have to make give comfy to the patient. So you have to give the call bell. Ma'am, there is your bell. So if you need something, you have to call us. Then you have to lower the bed for safety and raise the what you call this, the side rest. So after, so you have to dispose or disregard your materials, the dirty materials as agency protocol. And of course is okay. Before that, I will wash, and then I will wash my hands. So after washing my hands, I will document my MAR, or I will sign up my MAR. So ketorolac 30 mg IBPB every 12 hours is here. Now it's 10 ml, 1000. I mean the time it's here. So I will write my name here. So letter ILC or IB Luzon Luz-Cab. So I will show you in the camera. So this is it. Okay, this is the this is ketorolac 30 milligram IBPB every 12 hours, and this is 1000. So ILC. Okay, here. So ketorolac, this one, and then 1000. All right. So I'm done documenting. I'm done the charts. So before, I will wash my hands again. And I think that's it, my procedure today. And thank you very much and have a nice day.